Hello, my name is Raul Cortorial, and I will be giving an answer to Liz, a 9 years old uh, little girl, and her parents about her current health status. Good afternoon, Liz and family, and I wanted to take some time to discuss Liz's recent lab result with you. Liz, your mom has been attentive to your health concern, and it's important for us to understand what's going on so we can help you feel better. Firstly, Liz, your lab results have given us some valuable information about what might be happening inside your body. Let's start with your red blood cells. Liz, your red blood cells carry oxygen throughout your body, helping you feel energized and healthy. We use certain measurements to understand how well your red blood cells are doing their job. One of these measurements is called mean corpuscular volume, or MCV, which tells us the average size of your red blood cells. Your MCV is lower than what we typically see in healthy individuals. This means your red blood cells are smaller than they should be. Another measurement called mean corpuscular hemoglobin concentration, or MCHC, help us understand the amount of hemoglobin in your red blood cell. Your MCHC is also lower than normal. Now, let's talk about iron. Iron is a crucial mineral that your body needs to make hemoglobin, which is the protein in your red blood cells that carry oxygen. Liz, your lab results show that your iron levels are low, and your body's storage of iron, indicated by your ferritin levels, is also low. Additionally, we looked at something called total iron binding capacity, or TIBC, which measures how much transferrin, a protein that carries iron, is available to bind with iron. Your TIBC is higher than normal, indicating that your body is trying to compensate for the low iron level by producing more transferrin. Another important measurement is transferrin saturation, which tells us the percentage of transferrin that is saturated with iron. Yours is higher than normal, which further suggests that your body is trying to use whatever iron it has more efficiently. Lastly, we looked at your reticulocyte count, which helped us understand how well your bone marrow is producing new red blood cells. Your reticulocyte count is low, indicating that your bone marrow isn't making enough new red blood cells. Now, Liz and family, putting all these pieces together, your lab results suggest that Liz has what we call iron deficiency anemia. This means that Liz's body does not have enough iron to produce sufficient amount of hemoglobin, resulting in a smaller, paler red blood cell that can't carry enough oxygen to your body tissue. Liz, your symptoms like your stomach pain, fatigue, trouble concentrating at school are common with iron deficiency anemia. We also notice your unusual eating habits, such as craving non-food items like chalk ice, soap pieces, which is a condition called pica, often seen in individuals with iron deficiency anemia. The good news is that iron deficiency anemia is treatable. We can start by discussing dietary changes to include more iron-rich foods like animal-based sources, red meat such as beef, lamb, and pork, poultry such as chicken, turkey, fish and seafood such as tuna, salmon, shrimp, and oyster, organ meats such as liver and kidney, eggs, especially the yolks, plant-based source, legumes like such lentils, chickpeas, black beans, and kidney beans, tofu, and tepe. nuts and seeds such as pumpkin seeds, sesame seed, and almonds. Whole grains such as quinoa, fortified cereal, and old dark leafy greens such as spinach, kale, and sweet chard. Dry fruits such as raisin, apricot, and prune. Fortified foods such as fortified breakfast cereal, milk alternative, and possibly adding iron supplement to help replenish your iron store. Live, we are here to support you every step of the way and help you feel better soon. I have to explain also that we have a genetic predisposition to iron deficiency. But with Liz, there's not the case. But I have to explain a little bit more about these genetics. Certain genetic conditions can predispose individuals to develop iron deficiency anemia. For example, hereditary hemochromatosis, genetic disorder characterized by excessive iron absorption, can eventually lead to iron overload, but initially present with features of iron deficiency due to sequestration of iron in tissues. Understanding the genetic basis of iron metabolism can provide insight into the underlying mechanism of iron deficiency and guide treatment strategies. For example, thalassemia are inherited blood disorders characterized by abnormal hemoglobin production, leading to ineffective erythropoiesis and hemolytic anemia. Depending on the type and severity of thalassemia, individuals may develop iron overload due to increased iron absorption to compensate for a chronic hemolysis. However, in case of coexisting nutritional deficiency or chronic disease, iron deficiency anemia can also occur, complicating the management of this condition. Hemoglobinopathies, genetic mutations affecting the structure and production of hemoglobin, such as sickle cell disease or other hemoglobin variants, can lead to chronic hemolytic anemia. In this condition, individuals may experience increased iron turnover and may require high iron intake to support red blood cells production. However, iron overload can occur with transfusion therapy, exacerbating the risk of iron-related complications. Iron absorption disorders, genetic mutations affecting iron absorption in the gastrointestinal tract, can contribute to the development of iron deficiency anemia. For example, mutation in gene encoding proteins involving in iron transport or regulation of iron metabolism can impair iron uptake from the diet or release from the storage site, leading to systemic iron deficiency despite adequate dietary intake. Response to treatment genetic variability can influence individual response to iron supplementation or other therapies for iron deficiency anemia. Polymorphisms in genes involving iron metabolism, such as those encoding enzymes responsible for heme synthesis or regulators of iron homeostasis, may affect the efficacy. Personalized approach to treatment, considering genetic factors and patient-specific characteristics, may optimize outcomes and minimize risk. Understanding the interplay between genetic factors and iron deficiency anemia is essential for comprehensive management and personalized care. Genetic testing, when indicated, can provide valuable information for risk assessment, diagnosis, and treatment. Planning an individual with or at risk for iron-related disorder. Thank you very much. Hope this information will help you with you and your family. Thank you.